Thanks for taking your busy time out, Megan. I know you're just running here and there. Um, and I just wanted to get kind of an update from you on what's the latest? What do we know today as far as the state of Iowa and the state of whatever variants we're looking at these days?
No, thank you so much for having me, Rodger, and for raising these important issues because it's the only way that we can get people to be aware is if we start talking about it more. Um, so Iowa has been unfortunately heading in the wrong direction really lately. Our hospitalizations have been setting records, highest hospitalizations we've seen all year. And unfortunately, it's still the early part of the surge. The surge could get a lot worse. And there's the predominant variant right now is the Delta variant. I know that there's been a lot of talk of this new variant, B.1.1.529, which is also known as Omicron. And that variant has been identified in Iowa. We probably have more cases than we have documented thus far, and we'll probably hear of more happening over the next few weeks. But exactly what that means, we're still not sure yet.
How do we proceed if we want to keep our family members safe and ourselves safe?
It's a really hard time. I mean, last year, everybody was saying stay home for the holidays, and next year, we'll hopefully be able to be with our loved ones again. And so there was that hope that it was going to happen. And now we're so far into this pandemic. We have vaccines available to us, and everybody was hopeful that, okay, this means that we're going to be on the right trajectory soon. Unfortunately, when not enough people use the vaccines, when not enough people are using the public health advice, when we're not able to get it under control because people aren't masking, we continue to see this evolution of new variants, stronger variants that continue to spread this pandemic. And so until we can get everybody on the same page, we're going to be really facing a lot of these issues. And what that means is there's still a lot of things to be cautious for this year. We currently have 777 people hospitalized in the state of Iowa, the highest number. And that number is not going down anytime soon. We are running out of staff. We're actually hiring just 100 last week, 100 new traveling staff from out of state nurses to come in and man some of our hospitals because we're in a critical state where it's not just if you have COVID that you're being impacted, but if you're somebody who broke your foot, who has a heart attack, has a stroke, and you go to the hospital, the level of care, the expediency, the ability to get a bed is all going to be challenged because the whole healthcare system is strained. And that's why it's so important we each do our part. We have to pay attention to the public health advice. So, with family gatherings this year, make sure everybody's vaccinated and not just vaccinated, but boosted. Everyone not only qualifies for a booster that's over the age of 16 now, but should get boosted if they're at least 6 months out from their last 2-dose vaccine, or if they're 2 months after having gotten the 1-dose Johnson & Johnson vaccine. And masks, I know it's not how we want to connect with people, but if wearing a mask means that I can get together with my family who's all vaccinated and boosted safely during the holidays, then that's what I will do. It's better than not connecting with people, and it's better than sending somebody to the hospital 2 weeks after that gathering. There's a whole balance of trying to make sure people are safe while also trying to make sure that we don't take away from people's ability to enjoy life and have those connections that are so important to mental health. And the best way to do that is masked in indoor gatherings, masked in outdoor crowded spaces, but always vaccinated and boosted under it all. If we don't get more people vaccinated, that's one big stumbling block, but also more people wearing masks, because if we don't wear masks, we're not going to control the spread that's out there. And the more spread of the virus there is, the more chances there are for the virus to evolve and change and get stronger. And that's what we're seeing with this new variant, Omicron. It probably wouldn't have arisen if we had been able to get everything in check, people vaccinated, masked, and controlled that transmission rate. But because we gave it so many chances to evolve, it has changed. And what we say with each change, one change equals one mutation. And this new variant, we know that there are dozens of mutations, all in critical spaces that really change the way the variant could act. We don't have definitive information yet, of course, but the early data is showing us that this is a highly transmissible variant, more transmissible probably than Delta. It's outcompeting Delta in the places where it's emerged. So far, we've seen that it's causing a lot of breakthrough cases, meaning that people who are vaccinated can get this infection still. But we've also seen that it's reducing the severity of the infection. If you're vaccinated, you're boosted, you're more likely to perhaps feel symptoms of a cold. And so there's hope that vaccines and boosting, especially boosting to make sure that your antibodies are high enough, can be protective against the severe effects of this variant still. The extent to which that's happening, though, is something we still have yet to discover.
Do you think there'll be another booster
Down the line?
Yeah.
I wouldn't be surprised, just given the fact that we do see that antibodies wane. And it might be that the third shot is a great shot that lasts longer, and that booster might be a year from now instead, or something of that nature. I'm not saying that's definitely going to have a booster, but I'd probably be more surprised if we don't. What we're thinking is it doesn't cause as severe illness as Delta did, but it still can cause enough, especially in an unvaccinated crowd, that we could overwhelm health systems. And that is a big issue. Because of the increased contagiousness, the increased transmissibility. And if we're overwhelming health systems, once again, that impacts everybody. The heart attacks, the strokes, anyone who needs to be in the healthcare system.
Right, needs to use a hospital.
One of the things that we've seen in the early studies is that with this new variant, Omicron, while there is some evasion of the original vaccine, getting the booster has proven to increase the efficacy of those vaccines, even against Omicron. So that's why the booster is so important right now, especially with this new variant, making sure that you have the full protection you can in your body. The other thing that we have seen that has come up as questions is whether the monoclonal antibody treatments that we have for after people get sick, if those are going to be as effective. We're not sure. There's concern that they might not be, but we don't know that for sure yet. So we're still going to wait and see. The number one thing you can do, though, as an individual is get the booster, get vaccinated in the booster. And that is the best way to protect yourself against the severity of the disease.